Welcome to the meeting of the Corporate Parenting Panel taking place on Friday the 18th of February. The meeting is broadcast live through our YouTube channel. Before we commence today a formal business, I would like to cover some housekeeping issues. Please switch off and make silent mobile phones. Keep microphones switched off unless invited to speak. When invited to speak, switch on the microphone and introduce yourself. Adhere to social distancing and wear face masks when moving around. Right, moving on to part A of the agenda. Agenda item 1, apologies for absence.
Chair, we have apologies from Councillors Bell, Griffiths, Gunn, Hood, Roberts and Townsend, and from co-opted members Chris Baines and Julie Bell. Thank you.
Thank you, Jill. Item 2, substitute members.
Chair, we have Councillor Surtees substituting for Councillor Roberts. Thank you.
Thank you. Right, item 3, minutes of the previous meeting held on the 28th of January 2022. Can I agree the minutes? Can you agree the minutes and allow me to sign them? Any items, please? Jane did circulate answers to questions from the last meeting. Any other questions? I thank you, so I can sign the minutes. Declaration of interest. Any declarations of interest? No, does not seem to be any. Thank you. Right, item 5. Number of looked after children. Verbal update from Helen Ferguson.
Thank you, Chair. As of this morning, we've got 956 children in our care, which is an increase from the last time we reported the number. We are currently working with some of our children who've got plans of adoption, and there's been some recent case law which means that that's slowed down some of the decision making for those children, and that will create a temporary increase in our children in care numbers whilst that case law is kind of worked through nationally. So we might start to see a small increase, but that is likely to be a very temporary whilst we work through those issues.
Thank you, Helen. Item 6, Ofsted updates. Verbal update from Helen Ferguson and Martin Stenton.
We haven't had any further Ofsted reports published since the last meeting last month, so there is nothing further to update since we last met in the committee. However, there are 2 or 3 updates, not Ofsted related, but that will be of interest to people. The first relates to the ongoing fostering campaigns, foster care recruitment campaigns that we spoke about at the last meeting. I'm sure people will have seen as they drove into County Hall this morning that we have a big new board outside County Hall advertising the work of the council in relation to recruitment of new foster carers for our children, which is great to see. I know we spoke at some length at the last meeting about the campaign and distributed a whole range of flyers and information leaflets for people to take out to their constituency members. So I'm sure that that work is happening. And the last thing I just wanted to mention about the fostering campaign is that there's been a piece of work done to create a television advert, and that will go out on ITV at the end of February. So you will start to see that advertising the work of our fostering service and our recruitment for new carers to come and join us within Durham County Council and all of the support that we offer to our foster carers. You'll start to see that on your television screens towards the end of the month. The last thing I just wanted to make mention of is the CICCC report, which many of you will have seen published. It's a national report. It was the National Inquiry into Child Abuse. That report is being, the work of that report and the work in Durham in response to the report is going through the Children and Young People's Overview Scrutiny Committee in March, and will continue to be reported in there. So we will be able to bring further updates in terms of the progress around that to the corporate parenting panel as it pertains to children in care throughout the course of the next few months. Thank you, Chair.
Do you have anything to add to that?
Thank you, Chair. There's nothing new this month from Cliff, so nothing to add. Thank you.
Thank you. Agenda item 7, proud moments. Verbal update from Claire Morris. Claire, you've got 10 minutes, please.
Thank you, Chair. I like the way that you said 10 minutes because I'm very known for talking and the proud moments, aren't I? Because I'm so proud of everything. So I'd like to share today one of the proud moments from one of our children's homes who have just recently had their bathroom decorated. Now, as you know, in Durham, we're really committed to our children and young people living in fantastic homes, homes that are of the best quality that we can get. And I've got to say this bathroom is absolutely outstanding. Walk-in shower, big, huge rain head, so that they're standing under a really good quality shower. They're absolutely over the moon, the young people that live in this home. They're so happy and proud of their new marble bathroom that they had an opening event where the bathroom door was open. There was ribbon tied across the door. The young people had party poppers. There was the ceremonial cutting of the ribbon. And then there was the handing over of the first set of toilet rolls to go in the toilet roll holder, which the young people absolutely loved. Their self-esteem, their pride in their home is absolutely second to none because they live in fantastic accommodation, and it's their home and they're so proud of it. And then, like all good celebrations, there was a fantastic party tea with balloons and cakes and everything else, and those young people just could not be prouder. They are so happy. So I just wanted to share that with you because I think it's so important that we recognise how valuable it is to live somewhere really nice and how important it is that our young people feel that anywhere they live is their home and they own it and they live in the absolute best that we can allow them to, that we can afford, that we can get, that we can make and that we can maintain for them. So that's just today's proud moment, and I'm exceptionally proud of them. And I loved seeing the photos when they cut and they got the ceremonial handing of the toilet roll. It was absolutely comical, it was brilliant. So thank you very much for allowing me to share that moment today.
Thank you, Claire. I'm sure they'll really like and respect their new bathroom. It's lovely to hear. Right, agenda item 8. Investing in children. Children in the Care Council update. First of all, though, I would like to welcome Luke to the meeting. This at Mitchell has gone to university, so he is no longer with our Care Council, but we've now got Luke, so welcome, Luke, to your first meeting. So we've got Caitlin and Luke with Rob reporting, and they have got 15 minutes to talk. Thank you.
Hello, I'm Luke. Thank you all for inviting me. I'm very happy to be here. I am a new corporate parent panel representative.
So 2 CICC meetings took place in January and 19 young people attended in total. There was only 5 who attended the younger CICC meeting and 14 attended the older CICC. Both groups shared the CICC expectations that we wanted for this coming year, and there'll be a report that will be shared outlining CICC expectations for 2022.
The younger CICC group continue to focus on the All About Me project and discussing more ideas and where to progress it further and get out the key messages and able to present it in the next corporate parent panel meeting next month.
A further 2 CICC members facilitated an awareness session at Sunderland University social work students.
9 CICC members are finalising the full circle project to enhance the new therapy rooms and spaces via a graffiti workshop in February half term based on the previous designs and work.
5 care leavers from CICC connected with the strategic manager to review the local offer based on their experiences to inform strategic planning and feedback to share with them. We ask of yous to continue to enhance the local offer further with an ambition to make it the best in the country.
So over the last couple of weeks we've teamed up with the Cultures of Durham and try to make a few ideas for how to improve it and how to share ideas for the future. And over the last 2 weeks, a bunch of young people, different ages, came up with a few ideas. 14 CIC members attended yesterday, and that was to finalise that. And we came up with the time capsule idea.
We want it to be launched in 2075, and we worked out we would be 71. So that's so we were in a group and we thought it would be an amazing idea to make the council promise, and so everyone can look back at it, what it was like for us growing up and living with COVID and everything, and we want you to back us up on the idea if we don't win the culture bid anyways, but we think that would be an amazing project for it to happen. So yeah, that's it.
That's it from us.
Thank you, Luke and Claire. Anything, Rob, you would like to add to it, or?
I just want to back up on the idea of where the time capsule came from. So when they met with partners of Durham University to kind of review and look at the City of Culture bid, I think what several of the young people have looked into the future, as in that was their perception of culture and heritage. So their idea was almost children and young people getting behind an idea with the local authority to kind of come up with some ideas about who they are, about what the local authority might do in 50 years' time. And then it kind of connects the past and the present together. And I thought that was quite a savvy idea, actually. And that's why I think wanting corporate parent panel get behind it, because we don't know if we're going to be successful with the City of Culture bid. But I know from Durham County Council's point of view, whatever happens, they want to get behind some of the ideas and support the kind of vision of what people are coming through with. So I think that was one of the things they kind of suggested. They had some amazing ideas. They even had an idea about an called Durcraft, which was an app which aligned coal and the kind of pitting industry and young people going on a journey using an app to learn about the history and the heritage of the county. And I thought that was quite a good idea as well, and I think that the people we're working with are embracing the ideas. So we just need to keep an eye on if they're going to get behind the ideas regarding whether the bid's successful or not.
Thank you, Rob. Do we all agree as a corporate parenting panel that, having this time capsule is a good idea? Are we happy with that? Yes, would you like to comment?
Yeah, thank you. Councillor Angela said he's substituting for Councillor Roberts. Could I recommend that you link in with Durham History Centre around that, because that would be an excellent opportunity for the whole of County Durham and our looked after children as well, because the time capsule and the History Centre could go hand in hand. Thank you.
Thank you. Any other comments? Yes, Cathy.
Thank you. I read this and I thought it was amazing, so I would definitely like to give it my full support.
Right, thank you, Cathy. Michelle.
Thank you, Chair. Thanks for that, Luke, and welcome. It's very nice to see you, and I hope that we do do you proud as you do us. Make sure you tell us if we're going wrong. I just had a question when we talked about enhancing the local offer, Caitlin, you mentioned. What kind of things would you expect from us? What can we do to, what would that look like? You want us to enhance the offer. What will we do for you to consider that we've done a good job of that? Just some ideas around that, please.
Right, Helen, would you?
Yeah, maybe I can help you, because I know that there was a group of young people that met with Jodie Henderson, who's the strategic manager for our care leavers service. She couldn't be here today, and so they've done a fabulous piece of work, but it's probably just that group that know the detail. So we'll bring the detail back at some point and get some people to come and talk to everybody about it. But they've done a fabulous piece of work, and what the young people have done is look at the Durham local offer, and then they've also looked at lots of other local offers across the country, and they've done a kind of comparison to see what constitutes the very, very best, and where there might be some things that we could do in Durham that would add to what we're already doing. So I think the feedback was that it's a really strong local offer in Durham for our young people, and that was the feedback they gave us. But when they did this comparison work, they identified about five things that they thought we could do that would really add to what's already happening. And they were all things that are within our gift to do. So we'll come back and share the detail. But so, for example, one of the ideas was, at the moment, part of our care leaver offer is access to our leisure centres across the council. But one of the things that our young people told us about was that one of the things that they find difficult sometimes is that they can feel quite lonely. And so there was quite a lot of conversation about whether there were different and other things that we could do to support our young people who sometimes might feel lonely and on their own. And one of the things that the young people suggested was that, as well as being having access to be able to go to the leisure centres themselves, was it possible for us to look at whether they could have access to take a friend with them, so that it was actually a kind of social occasion rather than just a kind of keeping fit and healthy for them kind of occasion. So that was one idea that seemed to us to be something that we could probably take forward and do something with. There were two or three other examples, and we'll ask the young people who were directly involved in that work to come back and share those with you. But it's a really excellent an excellent piece of work, and I think that idea of comparing what's going on in Durham with other places, and we did come out very favourably, it should be said, was a really lovely way to start the piece of work. Does that sound all right, Caitlin? Yeah. Yes. Okay.
Councillor Miller.
Yeah, thanks, Chair. Yeah, I think that's a really great idea about the time capsule, but I was really interested when you said that it came from the history and the pits and stuff. Me and my colleague were actually attending an event on Sunday. It's 150 years since the pit disaster in Trimden Grange, and we will have a conversation outside if you want about extending that invite to some children in care. But also in Wheatley Hill we also have a little heritage centre where people come from North Shields, Newcastle, Gateshead, and it's a little mining museum. Again, happily to extend invite to come over to visit that sometime.
Thank you, Councillor Miller. Can I just say to Caitlin and Luke, there is no reason why you won't still be here to see the opening up of the time capsule. I know for a fact I won't be there, but I'm sure there's no reason why you two can't be there. Thank you very much, both of you. Right, agenda item 9, I think we're at. Place-based approach to early help for children and families in Durham. An update from Fiona Smith, the operations manager. Fiona, you've got 10 minutes.
Thank you, Chair. So I'm here to talk to you around Durham's place-based approach to early help. The background being that our approach is underpinned by our Durham Strategic Partnership approach to early help, and nationally driven by the National Supporting Families Programme, known in Durham as Stronger Families. Durham's performance on the delivery of the national programme to date is very impressive. Between April 2015 to September 2021, 5,851 families were supported to achieve sustained positive outcomes. This means reductions in children and parents and carers being involved in antisocial behaviour and crime or reoffending, more children accessing appropriate full-time education, improvements in family relationships and a reduction in domestic abuse, fewer families in financial hardship and more finding sustainable employment, and the health needs of families improved. Early help is not a single service or a team, but a way of working. It is made up of a system-wide approach to coordinating help for families, drawing on our shared assets. Early help is defined by the Department for Levelling Up Housing and Communities is the total support that improves a family's resilience and outcomes or reduces the chance of a problem getting worse, which requires all partners as part of the early help system to embed better ways of collaborative working to mainstream the whole family outcome-focused approach. Durham's early help approach involves whole family working. We absolutely recognise that parent and carers' needs impact on children and young people as much as children and young people's needs impact on parents. Therefore, we need to support the family as a whole. We also draw on our shared assets across the early help system, as no service can do it alone. We respond proportionately to need, so across the partnership and the early help system, we offer a range of support depending on need, from information, advice and guidance, self-help, and we are beginning to develop a digital offer further, to more targeted support, for example through our family centres, to intensive family support for those families with more complex needs. We do this in a coordinated way through a team around the family arrangement and have the principle of one family, one whole family assessment and one multi-agency child and family plan to really try and support families to only have to tell their story once. We have a shared multi-agency family outcome framework and we empower and build family resilience by putting them at the heart of planning and decision making rather than families feeling they are being done to and therefore at risk of service dependency. We want to help equip them with the tools needed when things get tricky and draw on their own family support networks. We want to better connect families to their natural communities, helping them feel a sense of belonging and to know where they can go for support rather than having to depend on a formal children's service. We have a vibrant voluntary community sector in Durham and we use our partners wisely to our Voluntary Community Sector Alliance programme. We apply a strengths-based approach through our Signs of Safety and Wellbeing and Practice model. We empower and honour families in what is working well and guide and support them to make sustainable plans to provide safety and wellbeing for their children. We also have an effective inclusive for all early help offer, wanting all children and young people to experience what I've just described. In 2020, we developed with partners and rolled out a new way for professionals to request early help for families. This involves the establishment of locality early help conversations in each team area. This brings together a range of partners to have a conversation about a child and family, share appropriate and relevant information, share decision making and draw on our collective resources from across the early help system, including our voluntary community sector. We use intelligence and data to help us know and identify family and community needs and target resource accordingly. Our new team around the school model, developed in July 2020, following a pilot in a social, emotional and mental health school, gave us the blueprint for a more sustainable model. This recognises the individual needs of the school, its pupils, parents, carers and its local community, and a multi-agency team around the school steering group has been established to further progress this work. Pre-pandemic, we had early help forums, which brought together a range of professionals working within a geographical area to discuss and to assess local community needs, emerging issues and action plan accordingly. This is due to be re-established this year and to be renamed Prevention and Early Help Forums to reflect the name of the partnership. We also think it's absolutely imperative that we engage the workforce and service users in all of our early help work. We do this through promoting what we do through our early help newsletters to really showcase integrated place-based working practices. We also ensure we have service user satisfaction surveys to help us identify where we're doing things well, but equally where we need to improve. We engage children and young people, parents and carers who are both service users and non-service users in early help developments. In recent examples are that of the new early help assessment, development of a self-help digital tool for reducing parental conflict, and we're currently co-producing a video and animation which will target the Durham population to explain what early help in Durham is and what to expect. So support for children in care and their carers. The Prevention and Early Help Partnership absolutely recognise the importance of ensuring children in care and their carers have access to a range of resources available in local communities at the earliest opportunity. An example includes specific support for kinship carers and addressing parental conflict as an extension of the Reducing Parental Conflict programme. We also have the post-adoption pathway, which has recently been reviewed, ensuring clear identification of family need and that appropriate support is delivered at the right time by the right service. We have early help representation at the Special Guardianship Review panel, and we also want to help and support families to tackle poverty. We know poverty can affect every area of a child's development, and it continues to be on the rise. Children who are looked after and their carers may need additional support to address this. The Child Poverty Working Group has developed a web page called Helping Families Manage Their Money, which has information on how to apply for grants, debt advice, financial help and budgeting support. We also have food parcels and a household support fund is available. And Durham has been awarded further funding for the free fun and food programme during school holidays. So in conclusion, the early help system offers integrated whole family outcome focused support delivered at the earliest opportunity, utilising our shared assets to wrap around a family. The Prevention and Early Help Partnership will continue to work with partners and service users to better understand early help needs and to help shape and influence our service. We ask for the Corporate Parenting Panel to note Durham's place-based early help approach for families, including those in care, and we ask members to promote our early help service and offer to their constituents. Thank you, Chair.
Thank you, Fiona. The recommendations are that we receive the update and further recommendations how best we can support the early help for families and children who are looked after and their carers. It's up to us as councillors to know exactly what is happening in our areas. Right, I think Councillor Charlton, would you like to comment?
Yes, thank you very much for that report. My question is around the team around the school. Is that now rolled out in every school in County Durham, including academies?
Not at the moment, no. So we had a pilot last year, and we've got a team around the school steering group. We're trying to identify priority schools to be able to target our resource, and we're using kind of national good practice examples to be able to do that. So at the moment, it's still in the planning stage, but the pilot that we did try was really quite successful, and it kind of gave us the blueprint to kind of roll that forward. So at the moment, no, but the plan is to.
Can I ask which school or where you ran the pilot?
Bindleston.
Right, thank you.
Thank you, Fiona. Councillor Varty, a question.
Not so much a question, thank you, Chair. It's just to say thank you for the work that's been done. I know that we have some wonderful staff out there doing this job, and I would like to say through this corporate panel a big thank you for all the work that is being done. Unfortunately, at the moment we have an awful lot of parents and their families that are coming in needing this help, but we do have the staff there and the workers that are there able to do it. So thank you to them, and thank you for the work that's been done. Thank you.
Thank you, Councillor Varty. Councillor Walton.
Thank you. Thanks for that, Fiona. I just had a question around the early help forums. It said that they were getting re-established. Are they currently re-established, or is that getting done this year? And sorry, I've got another question either way. How do people access them forums? How do they get to them to use them?
So we have our next round planned for March. We're going to be having them 3 times a year to correspond with kind of school terms. And each of the forums are going to take place in the north, south and east geographies. We're currently updating partnership kind of contact mailing lists, because we appreciate that pre-pandemic, when we had the early help forums, there's been a lot of change in staff turnover. So we're going to our existing kind of partnership arrangements to try and ask our partners who they would want represented on those forums, because we really want to have a place in a geographical area of the workforce who really know that community well, and be able to offer the resource to be able to address any emergent issues and basically action plan accordingly. So we're asking service leaders to identify who the most appropriate representatives are for that.
That's great, thank you.
Thank you, Fiona, for the reply. Right, we move on now to item 10. Children looked after with a disability. An update from Jane Ayres, Strategic Manager, and young people who were going to be in attendance, but unfortunately this morning we haven't managed to get any of our young children. So, Jane, you've now got 20 minutes.
Lovely, thank you. Good morning, everyone. I'd like to introduce myself. So I'm Jane Ayres, the Strategic Manager for Families First teams in the North and the Children with Disabilities team. And with me today is Laura Armstrong, who's the Professional Practice Manager. Members of the Corporate Parenting Panel have received a summary report which outlines the progress since the Ofsted ILACS inspection in September 2019. There have been significant changes to the services for the Children with Disabilities team since 2019. I'll just see the slide here. Some of these include remodelling of the service to create 0 to 18 children's service, including the creation of the 14 to 25 navigation service, which is based within the adult social care service. The creation of a governance improvement board, which is jointly chaired by heads of service, both from children's and the adult service. The team has had additional investment in staff, and we now have clear processes, guidance and procedures for practitioners, which includes a really robust eligibility criteria.
This is the right side.
Oh, is it?
Yeah.
My glasses aren't working. We now have a total of 227 children open to the Children with Disabilities team, and 28 of those children are in our care. You will meet in these slides some of our children, Isaac, Amelie and Philip. We have asked our children what they want from their service, from the team, and today we will present their views to you. So over to Laura.
Thank you, Jane. So our children have told us that they want us to ensure that they have a voice and that their wishes and feelings are known and understood, and that we really, truly appreciate their day-to-day experiences and what life is like for them, using their words. One of the ways we help children to do this is by offering our advocate via the NIAS, the National Youth Advocacy Services for all children. We also use Mind of My Own Express, and I'd like to show you a short video clip around this.
This is the Express app for younger children and children with additional support needs. Once a child logs into Mind of My Own Express app, they will be asked what they would like to be called and if they would like to add a photo of themselves. Once saved, they will then see this home screen, which includes the 5 topics for the child to click into and answer questions in. So as you can see, we've got all about me, my education, my health, my life, my day. So we'll go into all about me. And when the child clicks into any of the 5 sections, they'll be able to scroll down, select an answer using the colourful icons which illustrate each option, or write a different option in the something else box. And in this particular section, the child can create the profile page about themselves. So we can say that we like cereal for breakfast. And let's choose salad for lunch. Let's choose spaghetti for dinner. I don't like eating cabbage and sprouts. Things that make me happy, let's choose family and friends. Things that make me sad are, let's say, being on my own and being picked on. Things that make me angry are, let's say, people who are not nice to me. My best friend is, let's say that it's someone called Sam, and the best way to communicate with me is, we'll say, talk clearly. And then we have the save button at the bottom. So once we click on there, that takes the child to this screen, so they can add any additional notes that they want to there. They can take another photo, they can preview their answers, and then they can click on the send answers to my worker. So in the Express app, the statement is sent directly to the worker who the child's account is linked to. If the child wants to send it to another worker, they can state this in the any notes section so that the worker can then forward that statement onto the other person. So this takes us back to this screen. We can see all of our previous statements that we've sent, and then we can choose another topic, which takes us back to the home screen. So we'll have a look at my life. So here we...
Thank you, Jill. So just back to slide 2, if that's okay. When we are assessing children's needs, we make sure first and foremost that we make every effort to seek their views using the child's preferred communication methods. Alongside this, we consider any potential young carers in their brothers and sisters. And one thing that we ensure is that parents are able to access parent and carer assessments through our service or via the Carers Centre. We triangulate all of the information and assessments by asking our IRO officers to check in about what the child wants to happen or needs to happen. Thanks. Our children and young people really want us to understand their needs and the people who know them best to visit them regularly, to talk with them and on their behalf regularly, and for the team to complete a new assessment each year which focus on what is working well for the families and their carers. We build on our co-parenting relationships with children families and what needs to happen to meet the child's needs. Our plans are written by children and their families and carers and are updated regularly so that reviewed regularly so that we understand their needs and keep them safe. When it is time to be supported to independence, this is done alongside the navigation service, which sits inside adult services, and is done in a timely manner. We make sure the social workers from both parts of the service get to know the child together well over time. Our children want a team and their practitioners to know them well, and if we can't help them, we make sure that we find someone who can. We will do this by making sure that we are committed to the principle that our children have the same social worker throughout their childhood. We want to make sure that our team's culture promotes the building of good relationships with children, parents, carers, as co-parents. We have a team who encourages visits from our partners and fellow corporate parents. We are developing our feedback tools, some of which were listed in the slide above. On the screen, sorry. We have great representation, voice of the child, and children want to be cared for in their communities. They want to give us feedback and have people who think of creative ways to care for them. Our services need to be the best they can be for children and young people, and one of our current priorities is to develop a true co-production model. Over the last week and a half, I've had the privilege and the honour to go and visit and speak to some of our carers and children, and I've got some comments from them, what some of our children and our carers have said. One of our young people said, "The support that I'm getting, my own independence, but I'm already very independent. When I'm at the Metro Centre, the workers let me go and do bus spotting on my own. They're always upstairs in the Metro Centre, but I would like them to take me out more often and have more quality time. Another child told me that it means we get to see the same people and know what's going to happen next. And a further child told me that their social worker was very fun. One of the carers told me that the team were kind and caring, given the right information at the right time, even when the child that they're looking after doesn't meet the eligibility criteria. Over to Jane.
We'd just like to say thank you for listening to us today, but you are welcome to be involved with our work. We know you have a wealth of knowledge and experience, and we welcome any questions through the chair or via email, because we'd like to share them with the team so they can be involved and hear what you're saying or pick up any suggestions. So thank you very much.
Thank you for the report. The recommendation is that we accept the report. And now, have we got any questions? Councillor Walton.
Thank you, Chair. Thank you, that was really good and really useful. It's great that you are letting the families and the children lead what they want to see improvements in the service. So that's excellent that you're actually going to them and saying, what do you want? I'm just curious and wondering, out of all of that feedback that's come back, obviously the team's embracing it and working on it, what challenges are coming through? So some of the things that they've asked for, what are the more challenging ones that we need to be aware of and might have to put a little bit more work in for?
Thank you. I think for us, something that we're developing is our direct work with our children, because these are the children that can tell us, with help, using Momo, what they want. But there are children that parents are telling us and carers are telling us what the children want, but we don't actually know if that's right. So we need to develop lots of really different ways of communicating. We do have equipment, we do use tools, we do have strategies, but there's lots of things that people suggest. People talk about iPads, they talk about certain apps. So I think the team are just being really open, thinking different ways, and not just accepting necessarily what parents and carers are saying, because, yeah, parents and carers and schools, they absolutely do know, because they're with the children and young people all the time, but we need to see for ourselves, and we need to see what other people are doing in other areas, what other teams are doing, and just adapt those ideas. So that's our main challenge and what we want to do going forward.
And that makes sense. But again, it's reassuring that the challenge and that you're recognising that and addressing it. Is there a big uptake on the app? I mean, it's a great app and it looks like it's very easy, but do you get a lot of response on that app?
It's very new in Durham, mind of my own, so it's something that we're trying to prioritise, and I'm the manager for the Participation and Engagement Officer who's trying to promote that across the service. But particularly in the disability service, we've done group development around that, and it's something that we're trying out. It doesn't work for everybody, it's optional, but we continue to progress with that. Thank you.
Yeah, that's great, thank you.
Councillor Bainbridge.
Everything sounds fantastic. I would just like to ask, how many staff is on your disability team? Because you have 227 children, so I'd like to know how many children is allotted to the staff.
Yes.
You know, like how many?
It's not as simple as it sounds, because we have that number of children, but we also have developed a review and monitor system service. So there will be some children that will have an allocated family support worker all the time, but they don't actually, they have a one-off service, and they will have an assessment completed every year and a child in need meeting with a social worker and a family support worker, but the rest of the year they will be able to telephone the family support worker. So that number isn't divided by the number of social workers. It's actually, the social workers have a caseload of 20 to 22, but actually there sits a group of children here that are review and monitor. That service is fairly new, so we're working on that and really talking to other local authorities that, you know, have already had that in place. So that figure isn't a pure figure and then divided by the number of social workers. But if you did want to perhaps know a bit more about that outside, we can have that conversation. Thank you.
Thank you. Councillor Colt, please.
Thank you, Chair, and thank you for the report. I'm Councillor Bev Court, Eshenwood and Gilbert Ward. I've just got one question on the Mind of My Own map, which I think actually sounds fantastic, and I think it's really, really important that every child's voice is heard. The question I've got is, do we actually provide IT kit to children who may not have access to that? Thank you.
Not currently, but they can access it via the children with the Express app. They have to access it via their workers account, so they have to have a worker with them anyway. We do have the Mind of My Own one app that children can access independently, but for the children with disabilities, they really only do use the Express, and they use that with their worker or with their carer. So we are looking at ways and means that we can do that in a better way than using our very old standard laptops.
Thank you for the answers. All right, item number 11, Independent Reviewing Officer, the annual report, an update from Sharon Davey, Operations Manager. Sharon, you've got 15 minutes.
Thank you very much. First of all, thank you very much for having me. Yes, I'm Sharon Davey. I'm one of the IRO operations managers, and my role has been currently responsible for making sure our children in our care reviews are timely and for the best interest of our children, and making sure our foster care reviews are also timely in the best interest for our children and our children who are being cared for by their foster carers. I do have the privilege today of sharing the annual report, and I'm happy to take any feedback or questions today, but I think we'd like to share a bit more with you, because since the report was written, because I was due here in the December, we've now moved on, and we've got one of the expectations that we put for ourselves was to work really hard for our young people to understand what is a children in our care review, what does that mean, what are our meetings about, and we've worked really closely with our young people, the Children in Care Council. I can't take credit for the video. They wrote the script, they provide the voiceovers, they've been up to Newcastle, even in times of COVID, and managed to be socially distanced and record it all, and it's just absolutely wonderful. So I wanted to share that with you all today. So we have a video, and then I can take any further feedback or questions for how we're going to move things on for the next year.
Hi, my name is Zola, and I'm going to help you understand why some children might not be able to live at home. There are lots of different reasons, and some may be upsetting, as to why a child might end up in care and be looked after by someone else. It could be that their mum and dad have addiction problems like alcohol or drugs, and struggle to put their children's needs first and keep them safe. Their mum and dad might not be able to or know how to provide the important things to meet a child's needs, like having enough food or a safe home. It might be unsafe at home, with lots of adults shouting and fighting, and they need to be somewhere safe. Their mum and dad might not be able to keep them safe from others who might try to hurt them. They might be struggling to get along with their family. A parent could be in prison and a child needs to be cared for while they are there. Their mum and dad are ill or may have died. They may be unaccompanied minors, as their mum and dad might be in a different country, and they have no one else to care for them. So, first of all, Jack, try not to worry. There are lots of people working hard to make sure you will be safe and looked after well. When a child becomes looked after, they go and live with other people. These might be people they know, or someone they don't know. If you're going somewhere you don't know, your social worker will talk to you about where you're going and who you will be staying with. There are different places that children and young people live when they can't live at home, like living with a family member, an auntie or an uncle, or living with a foster care. If it is safe for you to go live with someone in your wider family, like your auntie, uncle, or grandparents who will look after you, with help from your social worker, you could go there. This is called kinship care, or living with a family member. Or you might go and stay with a foster carer. Foster carers care for children in their homes, so you could become part of the foster family, and you will also have your own family. Sometimes you might go to home with other children who are looked after. This is called a children's home. In a children's home, there will be other children with different staff members who care for the children, but every child has a key word. This can be better for some children. If you can't go home with your mum, dad, or someone else in the family, it might be that a new family is found for you to live with. This is called adoption. It only happens when the judge has decided you would be safe there in an adopted family. Okay, so what will happen next? So when you become looked after, there are lots of things that need to be sorted out to make sure that the people who are caring for you know how to take care of you. So you're not just cared for, you're cared about. The social worker will talk to you about what's happening and what will need to happen to sort everything that might happen. These are several things that need to happen, and your social worker will sort these out, such as your health assessment. All children and young people need to have things. It's just to make sure that we understand all your health needs, like whether you've been contenders. Personal education plan for pet for children. This is when we need help in school to make sure you have good learning targets and any help that you need to do as well as you can. So, there's quite a lot going on. Who can I talk to about all this? As soon as you become looked after, you will be given an independent review officer or our role children. They will remain involved for as long as you look after. The IRO works for Durham County Council, but is independent of the social worker team and the advocates, which means that they are there to make sure everything is working well. Before you meet your IRO, you will be sent a profile, which includes a picture and some information about them, plus their email address and phone number. Your IRO will listen to your views about these things and how you keep your links with people who are involved, and be responsible for leading the children looked after review meetings. What's a looked after review meeting? The children looked after review meeting is a recognized statutory meeting designed to look at how things are going on in your life. If you need to be met to make changes in the meeting. When we say statutory, this is something that the government has said all young people and staff. At the meeting, you, your mum, your dad, the person who will look after you, the social worker and your IRO. Might also be other people there, like your teacher. But remember, it's your meeting. Your IRO and social worker will be there to talk to you before the meeting about who you might want there and where you might want to meet and hang out. The review should always take place at a time within 10 minutes. The IRO will visit in your home on a video call or even just a telephone and chat with you before the meeting. If you want, talk about what you can say if you need. They can help you complete your plan of the meeting and help you run the meeting yourself. These meetings can be face-to-face or on video. Why do I need an IRO? Well, your IRO is very important because they are working hard to make sure that everything is right for you. At the meeting, they will look at how you function, where you live, who you live with, your education, health, people work, making sure that you know as much as you can and lead you to look after you. That everyone around you knows what you need, and everyone is working as hard as possible to make this happen. They will also travel to workers if this plan is not taking your meetings, or it's not the right plan for your future, and work hard to ensure that it does. In your meeting, you will talk about things like your happiness, as well as any worries you might have, how school, college school, when you can see your friends, what your family think, what your plan is, what things you might get up to, how you might see your family in your future. Your review is a great time for you to be able to think about things that you're happy about, what you might be worried about, or unhappy about, and what things you might want to change. When did these meetings happen? The first children's looked after review should take place 28 days after becoming looked after. The second review should be no more than 12 weeks after your first meeting. If you're still looked after, then they must be at least every 6 months or 20 days after any meeting should be in place. If there are any big changes in your life, the IRO will reach out if needed to arrange meetings so that everyone involved, including you, can discuss what needs to happen. How long will I be looked after for? The second children's looked after is important. Hopefully by then your social worker will have been overlaid with your family to know what your future plan will be. This is called a parent's plan. This is a plan that tells us exactly what needs to happen in the future. It could be that you'll go home, live with family members, stay with foster family, or in a children's home. This will be your long-term plan. It is different for each parent. What if I feel like no one's listening to me? If you feel that way, please tell someone. You can advocate. This is someone who you can talk to about what adults think is best for you, but you may not always agree with this and may want to make a complaint if you need to. If you are an advocate, your carers, social workers, or IRO can support you with this. You should have a chance to say what you think anyway, and to make sure it's being heard by the right people. Okay, that's good. Hopefully, that explains everything you needed to know about being a child who isn't living with their own family. Yes, thanks, Zoe. You're welcome, Jack.
So thank you very much. And like I say, I was just so proud. It was done with our Children in Care Council, a couple of our young people and our IROs. And I just, to let you all know, it is available now. It's on our Children in Care Council website. It's on our local Safeguarding Partnership Board website. And we try and... as often as we can when we go out to see our young people, because just picking up on what some of our fellow colleagues have said today about technology, our IROs have some Chromebooks that we use as well as our laptops that we take out on our placement visits. So if someone's a bit unsure, not quite clear, they can play the video. And it's also been helpful for some of our parents as well, understanding the process. And I must be honest, for myself as well. But yeah, so thank you very much. And if you could, any questions or anything I can help and support with, we certainly will. And again, as our colleagues have said, keen to hear from yourselves about any ideas moving things forward as well. Thank you for your time today.
Thank you, Sharon. That was so interesting to look at. It was really good for, you know, the young people. Right, questions? Councillor Walton.
Thanks for that, Sharon. I'll add my name to the list of people who learned things from that. That was really useful. But comes across in a very calm way and, you know, very understanding. I just wanted to check, is that shown to all children who come into care, or just those who express, you know, that they don't understand quite what's going on?
Our hope is it's shown to everyone. So an IRO placement visit should happen before the first meeting. So they should go out, meet the bairns, find out what they want to know, help them make their agendas for their meetings so that they can sometimes chair their own meetings as well. And so we're hoping that it should be for every child. But unfortunately, we've only just managed, we were hoping to go live last May, but due to some of the delays with COVID and getting our young people up there, it only went live last week. So I'm hoping, fingers crossed, this is our pledge, we're going to try and get this to all our young people, and all our workers know. Our lovely Helen sent that out in the comms so that it's there available for people so we can start and share it. So even if an IRO doesn't see a young person beforehand, our social workers can. So we're really keen because it makes it so much more simpler and in their words. That was the key bit for us.
Thank you, Sharon. Any more questions? Councillor Bainbridge, please.
Can I just say it was very child-friendly and the music was very calm and relaxing. So I think I could imagine small children enjoying that. The music would relax them and then watching what the other children had to say. Yeah.
Thank you.
Thank you very much, everyone. Right, item 12, any other business? I have got no other business given to me today. So, Helen, are you? We're doing that in part B, are we? No. Well, I have got a very sad thing to do now that I am. I know the lady concerned, it's Claire, and she is feeling rather sad this morning as well. Claire is leaving us to go to another authority. We thank her for all of her hard work that she has done for Durham County, and we are very sorry to lose her. But a sincere thank you, Claire, for everything that you have done for all of your hard work. Can we support her? Right, thank you, members. I have some tissues if you'd like one. Thank you. Right, seeing that we have nothing else to discuss in section A, the part A of the meeting will now conclude. Thank you to members of the public and media who have been watching the meeting. Can I request that those who are not part of the corporate parenting panel leave the meeting before we move into part B?